DPIs may seem easier to use compared to a metered-dose inhaler. There are certainly fewer steps and less hand-to-lung coordination is required, but unfortunately, incorrect technique potentially impairing drug delivery with DPIs is still too common. For example, in one study, 24% of patients did not use the diskus properly. In another study, poor technique was as high as 71%. While some studies show some slight differences, the incidence of poor technique between the devices, poor technique is a significant issue across all of these. Researchers have found associations between poor device technique and older age, fewer years of schooling, and lack of instruction by healthcare providers. Improper technique is not just a theoretical problem. It has been correlated to an increased risk of hospitalization and urgent care visits, more frequent courses of oral corticosteroids and antibiotics, and poor disease control. It is important to show patients how to use the device, observe their technique, and provide feedback. Let's review some of the common errors to look for. The first issue is the patient perception that they are not receiving any medicine from their DPI. This could be a misperception based on their experience with quick relief medicines and metered-dose inhalers. They are expecting to feel and taste the puff of propellant. So, when they don't feel or taste anything after inhaling from a DPI, they think they are not receiving any medicine. Because they don't experience immediate improvement with their DPI controller as they did with their quick relief inhaler, they think the DPI medicine does not work. But before you provide routine assurance that they are receiving medicine, you should observe their technique. Here are some common errors that would impair drug delivery. The patient may not be loading the dose correctly. This includes not priming the flexhaler on first use, or not twisting the dial all of the way to the right and left, or not twisting it twice, not pushing back the lever on the diskus, or not pushing it back all of the way until it clicks. Both the ellipta and the twisthaler require replacing and removing the cap to load the next dose. So not replacing the cap or replacing it improperly could prevent loading of the next dose. Using any of the devices after it is empty could also result in not receiving the dose. The next set of problems is related to loss of the dose before it can be inhaled. For example, shaking or exhaling into any of the devices could cause the dose to be lost in the back of the device. Tipping the diskus after the dose is loaded may also result in the loss of the dose. The diskus needs to be held level. There are several issues related to inhalation technique. Patients need to create a tight seal around the mouthpiece to generate the necessary inspiratory rate for the drug to reach deep into the lungs. Covering the air vents of the ellipta, twisthaler, or flexhaler could also make it difficult to breathe in quickly. Inhaling too slowly or shallowly will also decrease the amount of drug reaching the lungs. The flexhaler has a training device that can help assess if the inhalation rate of a specific patient is adequate. If inadequate inspiratory rate is suspected in a specific patient, the in-check dial might be helpful. That tool is discussed in another video in this series. On the other hand, inhaling too quickly causes more of the dose to impact on the back of the throat and be swallowed. Inadequate duration of breath holding. Adequate breath holding will maximize the amount of inhaled drug particles that settle in the lungs. While observing the patient, count how long they held their breath afterwards. 10 seconds is what is recommended. However, patients with moderate to severe COPD may be tachypneic even at rest and find breath holding very difficult. The ideal duration for breath holding is not known for most devices. Until further is known, encourage at least 5 seconds and for patients to continue to practice a longer breath hold. If a patient has difficulty with even 5 seconds, consider a similar drug in the ellipta. Adequate drug delivery with a shorter duration of breath holding has been documented with this device. While DPIs require little maintenance, properly closing the devices is important. Not closing the device increases the risk that the patient will inhale dust and particles. Also, as previously discussed, closing the device allows the next dose to be correctly loaded. Prematurely closing the device before the dose is inhaled will also cause the dose to be lost. Double check that patients are aware of and can read the dose counter. An advantage of the ellipta is the larger numbers on the dose counter for patients with poor vision. Lastly, be sure to check if patients are rinsing their mouth after corticosteroid use. Drug residue can cause thrush or hoarseness. There are some other potential patient-specific factors to consider when choosing the best drug delivery device. If a patient is very familiar with a particular device, changing to a different device can be confusing. If a patient has been documented to have good technique with one device, it can be helpful to stick with that device. For example, even slight changes in technique can be confusing initially for young children, those with low health literacy, or those who are easily confused. One advantage of the diskus and ellipta devices is that more than one drug is available individually and in combination and at different strengths. This makes it easier to transition and step up or step down in therapy because the device technique and the dose, 1 puff twice daily, is the same. Taking both drugs as a single inhalation in a combination product would also be more convenient and may also cost less. Another factor to consider is the age of the patient. We have talked previously of the importance of generating the necessary inspiratory rate. For these devices, at least 30 to 60 liters per minute is necessary to produce the desired respirable size drug particles. The flexhaler may require a higher rate. Young children have a harder time inhaling at this rate. Proper technique with the twisthaler and diskus has been documented in children as young as 4 years old. The flexhaler is only approved for children older than 6. Just because a child is the right age, don't assume that they can use the device correctly. The child's technique with the specific device should be directly observed. Inspiratory rate could be checked with the in-check dial. If there is any concern about the adequacy of the rate, remaining with a meter dose inhaler, with or without a mask, may be the better option. Currently, the ellipta is only approved for adults with COPD, not for children. But this may be related to the indication for the drug formulations rather than any age-specific device issues. Very elderly or those with severe airway obstruction also may not be able to achieve the required flow. The twisthaler, flexhaler, and ellipta all contain lactose. In the uncommon situation of a patient with a severe lactose intolerance, the diskus might be a better option. In this series, we are only discussing device issues. Please remember that there are also potential differences between drugs in the same class. For example, equivalent doses based on potency and incidence of adverse effects. The availability of insurance and formulary issues will also impact the selection of a specific drug product. Although the technique for DPIs is simpler than that for inhalers, poor device technique is still very common and results in poor disease control. It is important that patients are initially instructed by a healthcare professional. Actually observe your patient's technique and provide feedback. Patient's technique should be rechecked and documented periodically to ensure that patients are receiving the full benefit of the medication. Healthcare professionals should know the key features of and differences between devices. This will help when recommending an appropriate device for a specific patient. Remember, as a healthcare professional caring for patients with pulmonary diseases, device counseling is an important responsibility that lies with you.